We will now call the Community Public Safety Advisory Board meeting to order. The purpose of the Community Safety Public Advisory Board is to serve as a permanent independent committee in Oklahoma City that will review the complaint investigative process and results of completed departmental investigations involving Oklahoma City public safety officers. Is it on? Is my mic hot? It says it's on. Check.
You have the little mic like this.
I don't have that in front of me.
It's right here.
Oh, okay. I was just saying I didn't know if my mic was on or not. Sorry. All right, I'd now like to, so the instructions from the chair. Sorry, I'm normally not one to do this, but we're going to move to item 3, item for discussion and action. We're going to approve the minutes from the CPSAB forum held on April 15th, 2025, last month. Do I have a motion to approve those minutes? Do I have a second?
Second.
All in favor?
Aye.
So granted. All right, and now we're going to have a mobile integrated healthcare presentation from Lori Brown Loftus, Mobile Integrated Behavioral Health Response Program Manager. Welcome, thank you.
My name is Lori Brown Loftus. I am the program manager for the Mobile Integrated Healthcare team under the Operations Division for Oklahoma City Fire Department. So I'm here today to tell you a little bit more about Mobile Integrated Healthcare, how we are implementing this program in Oklahoma City, and how we're operating generally speaking. So again, Mobile Integrated Healthcare really is looking to reshape public safety in Oklahoma City in an attempt to provide an alternative to law enforcement response to help individuals, residents and visitors to Oklahoma City who are experiencing mental health or substance use issues to receive correct and appropriate care when calling 911. So what is Mobile Integrated Healthcare? So again, like I said, we're the part of the Oklahoma City Fire Department. We fall under the Operations Division. Our field teams consist of mental health providers as well as paramedics. We also have licensed clinicians, peer recovery support specialists, and then the mental health behavior health navigators, which are case manager certified through the state. One of our goals is to divert 911 calls. So whenever somebody's calling in to 911 and they're experiencing a mental health concern, we have a team that's located within the 911 Communications Center, and we want to be able to help divert those calls over to mental health professionals so that they can do an assessment over the phone, and then determine if there is a mobile response needed, or if somebody can simply be stabilized over the phone. And our vision is a safe and thriving city in which every call for assistance leads to a service that best meets that person's unique needs. So here is our team. We are a 27-person team. So myself, the program manager, our team lead clinicians, response navigators, paramedics, and peer recovery support specialists. So this was a picture taken with Oklahoma City Police Department. They were graciously hosted us for a reality-based training, which helped us to gain some situational awareness when responding to calls out in the field. Some of the benefits of our program really to ensure that individuals who are experiencing mental health crisis receive that response that's most appropriate for their needs. Also just supporting community members, so supporting family members, businesses, other just residents of Oklahoma City, making sure that we can help them with gaining and learning about resources that might be appropriate for them, and then overall really alleviating the response strain on ambulance, hospital, and law enforcement services. So traditionally, when you call 911, you're expecting to get IMSA or fire or police, and so we're really that fourth resource for individuals who are calling in who are experiencing mental health crises. So our structure, again, we're under the fire department, and then the mobile integrated healthcare program. And so I run all 4 of our unique teams, and I'll kind of get into what each team does and how they're comprised. But we have our crisis response team, alternative response team, crisis call diversion, and then community advocacy program. So these teams, some of them were already provided by the fire department. So especially the community advocacy program, that was a program that the fire department started about 5 years ago. And so when the firefighter, paramedic who was running that program retired in October, it came under to Mobile Integrated Health. And then our alternative response team is morph of the overdose response team that the fire department started about a year ago. So some of these incentives are ones that were already started by the fire department, and so we're just sort of putting them under the MIH structure and continuing and strengthening them and moving forward. So again, it's just sort of the 4 teams that are comprised within Mobile Integrated Health. So the first one that I'm going to talk about is our crisis call diversion. You may also see this being referred to as CCD, because we love an acronym, shorten everything. So again, these individuals are actually embedded within the 911 Communications Center. They are receiving calls as they come into 911. So if somebody is calling either for themselves or a loved one, or even somebody that, they're a passerby, we're able to get those calls immediately as they come into 911, connect with those callers. And again, the goal of our program is really a diversion program. We want to divert to the most appropriate resources. And so sometimes people who are struggling with thoughts of suicide or mental health symptoms are really just looking for support, and sometimes that support can be given over the phone. So our staff are able to stop and spend the time that that person may need speaking to them over the phone, whereas 911 call takers, the volume is so high, they don't have 30, 45 minutes, an hour to spend on the phone with someone to talk to them about how their day is. And that would just traditionally get a police response, when maybe if all that person is needing is a connection to resources or just somebody to listen to them. And then there's no mobile response needed. So that's saving an officer from responding, from fire or IMSA from responding. That's the goal of that program. However, we do know and understand that a lot of times when people are calling in, a mobile response or an in-person response is necessary, and so that team can also dispatch. So not only do they serve as call takers, speaking with individuals, but also dispatching our mobile teams and really being our resource managers, making sure that the correct team goes to the correct response and that we're prioritizing those requests that are coming in from the field as well, because we are getting requests from police officers who are already on scene of calls. So we'll get requests from them to respond to scene, and also calls coming in from the public. The second team I'm going to talk about is our crisis response team. You may also see this being referred to as CRT. This team is comprised of a paramedic and a mental health professional. And so they are going on those high-risk, high-priority mental health calls where there is an identified risk to self or others. So there may be a safety issue that has been identified in the community. This team is most often a co-response with Oklahoma City Police Department due to the safety issues that may be on scene. This may be that somebody is actively harming themselves or has a weapon or some sort of firearm where it would be in the best interest of not only the person who's experiencing mental health crisis, but also our field teams to have that be a co-response with law enforcement, so that way we're able to de-escalate the situation and help have the safest, best response for everyone involved, not just our response teams, but also for the individual. we are able to perform a medical evaluation because we have that paramedic. This eliminates some barriers for individuals who are seeking stabilization in our crisis stabilization units that are around Oklahoma City, that are run by our CCBHCs. So really being able to say, you know, sometimes an anxiety attack or panic attack feels like a heart attack. Our paramedics can do that medical evaluation and say, this is not actually a medical issue. We're looking at a mental health issue. Medically, they're cleared, they're okay, and then we can transport them to that URC. Whereas if an officer, you know, if an officer arrives on scene and someone's saying, I'm having chest pain, they're obviously going to call IMSA and fire to come out and address that. Our paramedics can address those issues on scene. And then also we're able to do that mental health evaluation. Excuse me. So we're able to evaluate them to determine, does this person need a higher level of care? Or can this person stay at home? Really, we want to keep people in the least restrictive environment, making sure that, you know, if it's possible for us to do a safety plan, for us to talk to some of their supports, that they can stay home with their loved ones, with their pets, with their blankets and things that are their creature comforts, that really, you know, research indicates that staying at home and in your supportive environment sometimes is the best treatment for somebody who's experiencing a mental health crisis. However, again, we also know that sometimes people require a higher level of care in order to maintain their own safety and the safety of the community. And so we're also able to transport. So you see a picture of our vans. These are specifically outfitted for us to be able to provide safe transport for individuals who may be needing a higher level of care. And then we have our alternative response team, again, also known as ART. And so that team is allocated to going on low priority, low acuity, nonviolent mental health calls. This team really does look to provide an alternative response to law enforcement. So whereas CRT oftentimes would have a co-response to law enforcement, we're really hoping that the ART team, as we learn more about the call types that are coming in, that ART team can provide a complete and alternative response to law enforcement. So an officer may never actually arrive on scene to some of these calls where you're just getting a mental health professional and a paramedic to talk to you, to help you, can take you to that higher level of care, but where there's no law enforcement interaction of that individual that's experiencing the crisis. Again, that team also serves as our overdose response team. So we're able to go out on active overdose calls. So when somebody has overdosed from a substance, an opioid substance maybe, we're able to go out, and while we are not going to be the first on scene because we don't have lights and sirens, we have to follow all the normal traffic laws. When IMSA and fire get on scene, even if that individual is taken to the hospital and we get on scene, we're able to provide a lot of support to whomever was around and may have witnessed that overdose. So it can be really traumatic for individuals who have a family member who may not have known that they had a substance use issue, and then all of a sudden they find them unresponsive. Our team can come on scene, talk to those individuals, provide them some resources in the community that they can access then to help themselves, but also help the individual that may be struggling with substance use. We give out overdose reversal education. We're able to do Suboxone inductions in the community. So this is a unique aspect of our team, and the reason why it's important that we have paramedics on our team. We're able to eliminate a lot of barriers by helping people start that substance use treatment in the field, in their home, and then making sure that they're getting connected to ongoing care down the road. So being able to do that, being able to do that Suboxone treatment in the field is really helpful in just making sure that individuals are getting what they need. Then we have our community advocacy program. This is known as CAP. The CAP program, again, that's been a program that the fire department has utilized for the last 5 years. Our team is taking over that program and really working with individuals who are high utilizers of 911 emergency services. So for an individual who may be aging in the community and doesn't have a lot of supports, natural supports in the community, they may know that when they call 911, they get a response. But really, what they might actually need is for somebody to come into their home and provide a grab bar next to the bathtub or provide a ramp in their home. And the reason they're calling 911 is because they're falling. And so really what we look to do with the CAP team is to, excuse me, let's get some water. What we're doing with the CAP team is really making sure that we are addressing the need long-term rather than addressing the singular need. Again, the fire department does an amazing job for individuals and making sure that they're safe and that they do get that immediate assistance. Sorry.
You're okay.
I've been talking a lot today. But again, just connecting them to those resources so that way we're building the capacity of Oklahoma City residents so we can lessen their heavy reliance on 911 emergency services. So the Public Safety Partnership and the Crisis Intervention Advisory Group came up with this crisis call triage that we utilize within our crisis call diversion. So it gives you a easy to look at graph of who you can expect at different types of calls. When there's a threat or a high risk, you're gonna see our CRT team, again, most likely with a co-response with law enforcement. When we're looking at the low risk calls, you'll see our alternative response team, crisis call diversion, and 988 doing those over the phone stabilizations, and then our community advocacy program working with individuals in the community and a lot of times after the fact of an emergency call. So the way people and the public need to know to access mobile integrated health is through 911. We are part of the 911 system, and I know that has caused some hesitation because people are concerned that if calling 911, they will get a certain type of response. We really want to help provide this education to the community to let them know that we are within this system and that we are there to help address those mental health needs as they come up for their loved ones and for themselves, that calling 911 is the best alternative in getting our response. But again, 988 is an amazing resource that's available to all Oklahomans across the state who may be experiencing mental health symptoms. So these are now just two of the resources that people can utilize. Okay, and that is all I have. I think we have a video, and then after the video, if you will have questions,
The needs for Oklahoma City response have definitely changed over time.
We've been able to recognize that not every emergency situation in our city calls for the same type of response. We have to adapt.
About 1 in 4 Oklahomans are suffering from mental health disorder, and hundreds of thousands across our state also with substance use disorder, and so the need is so high.
Mobile Integrated Health expands our city's emergency response by providing trained professionals as an alternative to police and EMS.
Whether it be a behavioral health challenge that they're going through, whether it be that they're just dealing with some type of addiction, we want to make sure that we're providing the appropriate response in the time of need.
The Mobile Integrated Healthcare team is underneath the fire department. But when you look at it, these are not firefighters. These are trained professionals, licensed counselors, behavioral health navigators, paramedics, and we have peer recovery specialists.
Not every single emergency response call requires a police officer. Not every call requires ambulance service.
This project is so innovative that we're going to have behavioral health calls responded to by a mental health integrated response. And that is so absolutely necessary for our loved ones who live with mental illness.
Other cities are starting to do something similar, but what makes us unique is providing this rapid, on-site response to our residents that are experiencing those crises.
We're seeing it make a big difference. We're acknowledging that the best response to a mental health crisis is a mental health professional to help de-escalate those situations and get them connected to care. In many cases, we are asking people in Oklahoma City to use our crisis lines like 988, but for people who they're not sure who to call or what to do, calling 911 now in this city gives them an opportunity to connect to mental health directly. The mobile integrated health program really benefits the entire community. They keep people out of unnecessarily and really costly levels of care. We know they're critical not only to helping families and people in mental health distress, but for the community overall. It saves lives and it saves money.
We are going to be able to ensure that when people are calling 911 and they're experiencing a mental health symptom or crisis, they know that that team is coming out and they are specifically trained to work with them.
We're not just showing up for emergencies, we're helping prevent future crises.
Mobile integrated healthcare is a group of individuals that are highly trained, highly professional, that care about our residents, that are responding to their crisis and meeting the need.
Okay, does anybody have any questions or comments for Lori?
Yes.
Are there funds set aside for the elderly that might need a grab bar or a ramp, or is there some other way that those funds are provided so they can get that for their home?
So our CAP team has worked really hard to build a lot of really important relationships in the community. So essentially what we're doing is, because we are able to identify someone at the moment of their medical emergency or whatever emergency they're having in their home, we then can get them, we know or identify those people, and then we can get them connected to the resources that already exist within the community that can help provide those services to them in their home. Yeah.
Thank you for that presentation. I was wondering on the community education, the Suboxone and the Narcan education, have you been able to track any results? Has there been any reduction in the overdose crises that we've had, both emergent responses and deaths?
So our team has not been doing that for very long, maybe about 2 months.
Okay.
So we don't have any data that would be significant at this point to show if there has been any decrease.
Okay.
Yeah.
Is that something that the team is tracking?
Yes, so we look at overdose calls, and the state has initiatives as well, that because the state has the Narcan program, that's who we receive the Narcan from. So they track a lot of those metrics as well, just statewide, but for our team specifically, we can track sort of just the small, portion of individuals that we serve in this state. I say small, it's large, but
Right.
but still, it's not the statewide numbers that the Department of Mental Health and Substance Abuse are tracking.
Okay, thank you.
Anybody else? Thank you so much for coming, and sorry about the sound issue. I
Oh,
don't
no
know what was
problem.
going on. But thank you so much. That was actually very enlightening. Thank you.
Yeah, thanks.
Okay, we will move on to item number 4, public comment. Has anybody signed up to speak? Does not appear so. So we will then move into item number 5, enter into closed session to review the cases. We've got 1, 2, 3, 4, 5, 6 today. So what does move us in there? All right, we were going to move into a closed session. All right, we are back from executive, or not executive session, sorry, that's city council. Closed session to review cases. Regarding 2025-513-01, the committee offered letters of support. Regarding 2025-513-02, the committee offered letters of support. Regarding 2025-513-03, the committee offered letters of support. Regarding 2025-513-04, the committee offered letters of support. And regarding 2025-513-05, the committee offered letters of support. Is there any other comments from the board? If not, I would say we're adjourned.